Cambodia and I realized what a huge need there was for pediatric ophthalmology. And then it just went on from there. And when I came back, I did a surgical expedition in another hospital. And I met Dr. Rowe was attending one of my lectures, and he kept telling me that I needed to come to CSC because this is where the poor people were. And that was my whole goal in coming to Cambodia, was to reach out to the children who cannot afford to have eye care otherwise. I think about the surgical procedures that they want to, the skills of which they want to transfer. And then they need to bring everything they can that they need for those surgical procedures, not expect to find it here. We do a lot of pediatric congenital ptosis where the lid is down. And so I brought fascia lata, which was donated by the tissue bank, enough for all of the cases that we would be doing while I was here, but also to leave some behind. I brought special sutures. I brought the implant spheres and conformers because they do evisceration and enucleation almost every day. And cosmetically, it's really a shame. Came true. Guess she gave. Well, this is my 13th visit to Cambodia and my 14th visit, my 11th visit here. So the first day is, the doctors know I'm coming. So it's almost overwhelming because they bring in all of the babies that they've been saving up and which have diseases that are difficult to treat. And so they wanted to be able to have those children here and do the cases while I'm here. So you have to remember that this clinic is non-air conditioned, and there's all these children and their parents in the room with all of the doctors, and it's very crowded and very hot. And the babies are crying, and they're hungry because some of them are being kept for surgery. They have to be NPO, nothing by mouth. So it's really hot and really crowded, and the babies are crying. And so we're trying to examine all these children, and we're bending over because they're sitting in a chair on their mother's lap or whatever, and we're having to examine them in that. It's a makeshift clinic because we're waiting for the new one to be built. The staff is dedicated, and they really are dedicated to learning what they need to know to deliver first-rate health care, eye care. They have a little inferiority complex. They feel that they've been marginalized because they don't have all of the equipment and all of the training that doctors in Western countries have. But I have to keep reminding them that it's the outcome that counts, not so much whether you use the newest phaco or the foldable IOL or whether you have the latest laser. You have to approach each case with a mindset that you're going to make this patient better, not only more comfortable, but see better. And you have to use whatever equipment you have. So they're very good. They're very good. They're very innovative. Well, I love being here. I love seeing the variety of patients, and I especially love working with children because they're the future. And reminding these doctors that these children have to live with whatever result they get for the next 70 years. So you really have to put that into consideration. And I think it's so important to use our resources to take care of the children's vision, because when a child is left blind, the degree of social, I get very emotional, so the degree of social misery and social burden and personal misery is so much greater than in an elderly person who needs cataract surgery just because they want to see their grandchildren's faces, but they're not working. So it's really important to take care of the kids.